presentation that we have put up around the office has been nutrition, and specifically nutrition geared toward weight loss. And the main reason I described it that way is that in the past, a lot of my nutrition classes have been about optimal nutrition for better health, but not specifically targeted toward weight loss. So tonight it's going to be a little different than some of those talks that I've done in the past. We're specifically going to be talking not only about nutrition for weight loss, but really a different problem, a problem that's called metabolic syndrome that they referenced in the short video that I let you watch, which really, the great thing about this is that the approach that I have as a chiropractor, or that the clinic has here, is to improve your overall health. The things that we're going to talk about and recommend tonight are something that will help anybody that not only needs to lose weight, but anybody that has metabolic syndrome. So I'm going to go through and cover the presentation, and then partway through, actually Nahala Jacobs, who is a representative from Metagenics, is going to cover some of the specifics about some of the products that can help in this process. Okay. First of all, a lot of people haven't even heard of the term of what metabolic syndrome is, but it's a big problem. 1 in 3 Americans would be classified as having metabolic syndrome. Metabolic syndrome is not only associated with being overweight or obesity, but in my opinion, actually more importantly, it's associated with increased risk of heart disease, increased risk of type 2 diabetes, of basically inflammation. And it used to be called, some of you might have heard of something called Syndrome X, or Insulin Resistance, which is a former name that metabolic syndrome used to go by. There's the way that we categorize metabolic syndrome is basically if you meet certain criteria for different risk factors. If you meet 3 out of the 5 risk factors, you would be considered to be in that group of having metabolic syndrome. And I'm going to go through each of these kind of individually. The first one is something that's a very easy test you can do yourself, and that's just a waist measurement. We have probably, most of you know or have heard doctors say before that if you're apple-shaped, that's unhealthy for you. Belly fat, that's why some of the posters we've had around the office to promote this have had a picture of a lady, and it says on it, belly fat, doesn't look good on you and doesn't look good for your health. And that's because that's a predictable risk factor for heart disease as well as diabetes. And specifically, if you're a woman and your waist measurement is more than 35 inches, or you're a man and your waist measurement is more than 40 inches, that would give you this risk factor. Okay? If you have elevated triglycerides, which are a fat, this is something that you would get from blood work that maybe your medical doctor would order, or if you're taking medicine for elevated triglycerides, that would be another risk factor. If you have reduced HDL, or reduced good cholesterol, unfortunately, most of the time what we hear about is people saying my cholesterol is too high, and they're concerned about taking medication for driving down their cholesterol. But what a lot of people don't realize is that most of the research is showing that there's problems with a lot of the statin drugs, like Vytorin and Celebrex, and not Celebrex, Vytorin and the drugs that they use, the statin drugs for reducing your cholesterol levels. But a bigger thing is that most of the research is showing is that your ratio of good cholesterol, HDL, to your LDL, or your bad cholesterol, and your total cholesterol, and also the ratio of that to your triglycerides is much more important. So anyway, if your good cholesterol is low, that also is a risk factor, or if you're taking medication for controlling your cholesterol, that would automatically give you that risk factor. If your blood pressure is elevated, if you're more than 130 over 85, or if either of those numbers is elevated. So let's say your systolic is fine, that it's 120, but your diastolic number is 90, that would give you this risk factor. Okay? Or if you're taking medication for blood pressure, that would give you this risk factor. If your elevated blood sugar is over 100, that would also be a positive risk factor. Okay? Or obviously if you already know you have type 2 diabetes, or you're being treated for elevated blood sugar. So what's the big deal about metabolic syndrome? It's associated with increased risk factors for especially heart attacks, or heart disease, strokes, and diabetes. But it's much more than that. If you're diagnosed with metabolic syndrome, you're 9 to 30 times increased risk for developing type 2 diabetes, if that's not already one of the risk factors, and you're 2 to 4 times increased risk for developing heart disease. The this is really, I think, an important picture. That this really kind of shows you the overall big picture. That really the root of metabolic syndrome is insulin resistance, and as a result of insulin resistance, how your body regulates sugar is the increased inflammatory process on a cellular level throughout your body. It's not the kind of inflammation like Nahal and I were talking about earlier, like somebody necessarily have a large knee that's swollen, from twisting their knee or injuring their ankle, although this could make somebody pro-inflammatory where they'd be more likely to have musculoskeletal inflammation, where you might come in and as chiropractors we say, you're really inflamed in this area. If you're, from a biochemical standpoint, if your body is pro-inflammatory, it could lead to that. But it's so much more. It can increase your risk for type 2 diabetes, sarcopenia, which is loss of muscle, problems with sleeping, obesity, fatty liver or elevated liver enzymes can be associated with metabolic syndrome, osteoporosis, kidney damage, cancer, which is a huge concern, dementia. PCOS is polycystic ovary syndrome, which is a problem that women will have where they have severe problems with their menstrual cycles, erectile dysfunction, hypertension. Dyslipidemia just means elevated or abnormal levels of your blood fats, and then cardiovascular disease. So you can see that it really affects your whole body. And so many of you might have come tonight, to get information about losing weight, and that's important. That's a good goal. But the thing about the way we're going to approach it is that many types of weight loss are actually unhealthy for you. You probably all know that yo-yo dieting or crash dieting is not healthy for you long term. So this approach is really designed to improve your health, and a beneficial side effect of that is to allow you to lose weight as you're doing it, but to do it in a healthy way. Okay. The conventional approach for many of the problems that were on the previous slide are to treat each individual problem separately. So to give you a medication for your heart disease, give you a medication for your PCOS, give you a medication for your erectile dysfunction, one for your elevated triglycerides. And the problem with this is that it doesn't get at the real root problem, but also all those medications have potential side effects. So if we can do it from a natural standpoint, and I don't know if you heard this, as the doctor mentioned in the short video I showed you, it's very successful using this approach that I'm going to talk about tonight at improving these all of these risk factors without having to use medication. So I really personally think that it should almost be malpractice if a doctor doesn't try a natural approach like this first, but resorts right away to using drugs that can be potentially more dangerous. So there are other options for managing it, and the main approach is, in the video they talked about something called first-line therapy, which is a way to is the whole approach, but the main product that we utilize is called Ultrameal Plus 360. And I'm going to have Nahala actually come up and describe some of the specifics of the product, and then I'm going to finish at the end with more specifics. Okay?